I first got a ganglionic cyst when I was in high school, so 4 or 5 years ago. And I had more than one because I had been doing a lot of shucking over the summer because I catered raw bar. And I went to the doctor and they told me that options were to wear a wrist brace and hope that they went away, have the ganglionic cyst drained, or to have surgery to remove it. They said that the brace was probably the best option for me since I was in high school, and that draining wasn't a guarantee that they wouldn't come back because they could just fill back up, or surgery wasn't necessarily a guarantee because if they didn't remove the entire shoot coming up from between the joint, then they could grow back. So I wore this wrist brace on and off when my wrist would get irritated for the last 4 or 5 years, and 2 of the 3 ganglionic cysts that I had left. I still have a ganglionic cyst that's really wide and flat in my wrist. Difference, it's this lump right here. So I discussed with my doctor the last time that I went to my GP what my other options were because the wrist brace wasn't seeming to work, and taking several hour finals or multiple finals in a row or taking notes in class was really irritating my wrist because the ganglionic cyst was adding pressure, and so it was a lot of extra effort to write for long periods of time. The doctor recommended that I go see the wrist specialist and discuss the options of either draining or surgery. I opted for surgery because of the likeliness that it would come back, since this was a very persistent ganglionic cyst to begin with. Draining was the other option, which it isn't a guarantee that it won't come back, and since this one's so tough, it probably would have. So I saw the wrist specialist. He told me the information I already know. Ganglionic cysts, they're not exactly sure what the cause is, but they can be quite persistent. It can take 10 years or longer for them to go away, depending on how tough they are and depending on how irritated your wrist gets and things like that. They can be on your fingers or on your wrist, on the top or bottom. The stalk of the ganglion comes up from between a joint, and then there's a balloon of fluid on top of that, which can cause the pressure and the soreness associated with ganglion cysts. Sometimes ganglion cysts are completely painless. They take no real effort to take care of because they just eventually go away on their own. My ganglion is a dorsal ganglion. It's on the top of my wrist, and it has been irritating me for long enough that I'm ready to just have it removed. The wrist surgeon that I'm seeing is well known for how well he can complete wrist surgeries, and he told me he hasn't cut a tendon yet, so he doesn't plan to now. Luckily, most of the important components of the wrist are in the bottom part of the wrist. Overall, it's not too dangerous of a surgery by any means. It's one day you come in, they take it out, and then you can leave. Draining is a viable option if somebody is thinking that theirs will probably go away from that, or if they don't want to have an operation. That is another valid option. The wrist brace worked really well for my other ganglion cysts, but this one just is very persistent and doesn't want to leave. I do lift weights, and I do a lot of writing. I do a lot of work on a computer, and I shuck clams and oysters, which puts a lot of pressure on your wrist. So my wrist, I think, just gets too irritated by all of the movement. So I think that overall, I just kind of beat it up. I highly suggest that you don't try to hit your Bible bump with a big book. They're called Bible bumps because that's how they used to be taken care of. People would grab the biggest book in their house, which was traditionally a Bible, and they would whack the cyst to burst the sac. This can damage other important components of your wrist or your finger, since the shoot does go down into your joint, and you can just end up having worse issues later on. They can also come back if you do that because you're just popping the sac that the liquid is in, and you're not necessarily causing it to become removed from your wrist. which is similar to the draining, and that's why sometimes they come back when they're drained or when they've been popped. Today I have my pre-op physical for my surgery, and then a week from today I have my surgery. They gave me an information sheet which just says basically the same things about a ganglion cyst. Here's a picture of a ganglion cyst. The shoot goes down into the wrist and it's just a bubble. They also gave me an information sheet of how to prepare for the surgery, which is essentially directions for using this soap scrub. They actually say to clean your whole body from the neck down the night before, and then the day of the surgery to wash the area that is getting surgery done on again with it. This kills all of the bacteria and things that are on your skin so that it is a more safe environment for them to do surgery on, so that it's completely sterile. They of course will clean it again once you get to the hospital, but this is just to help that process and to ensure that the area is safer to operate on.